Imagine arriving at the hospital in 2040. The first thing you notice is what's missing: the chaos. There is no crowded waiting room, no line for a check-in desk, no frantic search for paperwork. Your journey began before you even left home. Your personal AI health assistant detected an anomaly, scheduled your visit, and transmitted your complete medical profile, your digital patient avatar, directly to the hospital's central nervous system, the Flow Manager AI. As you step through the entrance, the environment itself recognizes you. Subtle biometric sensors in the doorway scan your gait, your body temperature, and your heart rate, confirming your identity and gathering initial vital signs in a single seamless motion. A gentle, calm voice addresses you by name from a discreet speaker. "Welcome, Alex. Your med-bay is ready. Please follow the blue path." On the floor, a soft, illuminated pathway glows to life, guiding you forward. There is no confusion, no stopping. The Flow Manager AI has orchestrated your entire arrival. It has pre-assigned the optimal treatment bay, prepped with the specific diagnostic tools anticipated for your condition, even notified the relevant specialist that you are on your way. You are not a number in a queue. You're a data point that has already been processed. The era of the waiting room is over, replaced by a system of intelligent anticipation. The hospital is no longer a reactive facility you visit when you are sick, but a proactive partner that prepares for your arrival the moment you need care. This is the new first impression of healthcare.com, efficient and centered entirely around you. The moment you enter your med-bay, the real magic begins. Your physical self is only half the patient. The true diagnostic powerhouse is your digital twin, a living, breathing computer model of your body, continuously updated in real time. Data streams in from every possible source. Your smartwatch tracks your vitals, but that's just the start. A tiny, discrete Lobonochip sensor on your skin analyzes your blood chemistry continuously, monitoring for microscopic changes. This real-time data is fused with your complete genetic blueprint, your historical health records, and even your gut microbiome profile. Your digital twin absorbs it all. This is not a static chart. It's a dynamic simulation of you. While you sit comfortably, your virtual counterpart is running thousands of diagnostic scenarios in a digital space. The AI Diagnostician doesn't guess. It simulates. It pinpoints the precise molecular pathway of an emerging illness long before traditional symptoms would appear. It identifies a medication intolerance by testing the drug on your digital twin first, seeing the adverse reaction in silicon instead of in your body. This changes everything. Instead of a doctor asking, "Where does it hurt?" the conversation begins with a confirmed analysis. Our models show the inflammation is concentrated in these specific nerve clusters, and we've already simulated 3 potential treatment paths. The digital twin responded with 94% efficacy to option B, with minimal side effects. Diagnosis is no longer a detective story. It is a calculated, predictive science. Your physical body is simply the final validation point for what the AI has already discovered in your virtual one. This is the end of trial and error medicine and the dawn of precision care, tailored to the most unique, complex system in the world, you. Your journey leads you not to a sterile room, but to a personalized treatment pod, the Med-Bay. This is your adaptive environment for healing, a seamless fusion of comfort and cutting-edge technology. The door slides open to reveal a space that has been prepared specifically for you. The lighting adjusts to a calming hue, and the ambient temperature shifts to your documented preference. The walls themselves are intelligent surfaces. It's embedded with environmental sensors that monitor air quality and subtle pathogens, ensuring a pristine environment. At the center is the self-adjusting bed. It's not just for comfort. It's a diagnostic and therapeutic platform. Using micro-movements and surface sensors, it continuously monitors your heart rate, respiratory patterns, and restlessness, feeding this data directly to your digital twin. From the ceiling, sophisticated, multi-jointed robotic arm rests in its dock. This is not a menacing machine, but a precise tool. With silent efficiency, it administers medications, draws blood with pinpoint accuracy, or performs minor procedures like suturing, all guided by the AI Diagnostician's flawless data. Your fear of needles and human error becomes a thing of the past. Most remarkably, the ambient AI is always present, yet never intrusive. It analyzes your voice for stress, observes your facial expressions for pain, and monitors your activity. If it detects anxiety, it might subtly dim the lights and initiate a calming audio landscape. The entire pod is a responsive partner in your recovery, a living entity dedicated to a single purpose: restoring your health with an unwavering, precise, and personalized attention that was once impossible. This is no longer a hospital room. It is your guardian chamber. The operating room of 2040 has been transformed into a hybrid reality command center. The sterile, bright space is now a dimly lit theater of data, where the physical and digital worlds merged to achieve surgical perfection. The surgeon no longer stands over the patient for hours. Instead, they guide the procedure from a console, their expertise amplified by autonomous robotic systems. These robotic hands operate with a superhuman steadiness, capable of movements finer than a tremor. Guided by the precise roadmap provided by the patient's own digital twin, hovering over the patient is a breathtaking augmented reality hologram of their anatomy. The surgeon can see through skin and bone to critical structures, tumors, and blood vessels, which glow within the hologram. They can peel away virtual layers to plan their approach, with the system highlighting the safest path and warning of potential risks in real time. This entire procedure was rehearsed and perfected hours before the patient ever entered the room. The surgeon practiced on the patient's exact digital twin, running through every possible scenario. The AI suggested optimizations, and together they choreographed the operation down to the millimeter. This is not surgery by robot. It is surgery by a seamless partnership. The surgeon provides the decision-making, experience, and judgment, while the AI and robotics provide flawless execution and superhuman perception. The result is a new era of safety and efficacy, where every operation is planned, practiced, and performed with godlike precision. The era of one-size-fits-all medication is over. In 2040, the hospital pharmacy has been transformed into a compact, on-demand manufacturing hub, where your prescription is printed, not poured. Upon confirmation of your diagnosis, the AI formulates a drug regimen unique to your body. This data is sent directly to a 3D bioprinter within your Med-Bay or a central pharmacy. Instead of a standard pill, the printer fabricates a polypillous single, complex tablet with multiple chambers. Each chamber releases its specific medication at a precise time and location in your digestive tract, optimized for your metabolism and genetic profile. The dosage is calculated in micrograms based on your weight, age, and even the real-time performance of your liver enzymes, fed from your digital twin. For critical treatments like chemotherapy, the technology goes even further. Medications are packaged into microscopic nanocarriers, engineered particles, programmed to seek out and attach only to specific cancer cells. This targeted delivery system attacks the disease with pinpoint accuracy, leaving healthy tissue untouched and eliminating devastating side effects. This is the ultimate expression of personalized medicine. Your medication is no longer a mass-produced chemical, but a bespoke medical device, engineered from the molecule up for you and you alone. The guesswork and side effects of traditional pharmaceuticals become a relic of the past. In 2040, recovery is no longer a waiting game. It is an active, accelerated process guided by biotechnology. The moment a procedure is complete, advanced healing systems engage. For a complex bone fracture, a 3D printed bioscaffold is implanted. This isn't just a support structure. It's a lattice infused with the patient's own stem cells and growth factors, actively commanding the body to rebuild bone perfectly, reducing healing time by weeks. Smart implants go a step further. Placed at the injury site, these devices monitor the healing process and release precise doses of therapeutic agents exactly when and where they are needed, creating the perfect biochemical environment for regeneration. The body's natural electrical signals are also harnessed. Targeted microcurrent stimulation accelerates the repair of nerves and muscles, guiding them to reconnect and strengthen with remarkable speed. Pain management and physiotherapy have also been revolutionized. Instead of heavy sedation, patients use immersive virtual reality. They can enter calming landscapes that directly modulate pain perception, or engage in gamified physical therapy that encourages movement and tracks progress with perfect form. Recovery is no longer passive. It is a directed, technologically supercharged phase of treatment, transforming the body from a patient into an active participant in its own healing, dramatically shortening the journey from hospital bed to full health. The most profound change in 2040 is that the hospital's reach extends far beyond its physical walls. The concept of discharge is redefined as you transition seamlessly to the invisible hospitala, continuous care system in your own home. You leave with a sophisticated yet discreet monitoring kit. Smart patch on your skin tracks vital signs, while ambient sensors in your home monitor your activity, sleep patterns, and even medication adherence. This data flows continuously back to the hospital's central AI for many conditions. Complex care is managed through comprehensive hospital at-home programs. You receive scheduled visits from medical professionals, while 4 medications and advanced therapies are administered remotely through smart systems. Your living room becomes your recovery room. A 24/7 AI nurse is your constant companion, accessible via a simple voice command. It answers questions, reviews your data for anomalies, and can instantly connect you with a human specialist if a red flag is detected. Your digital twin remains active, simulating your recovery progress at home. If the model predicts a potential complication, your care team intervenes proactively, often before you even feel a symptom. The hospital is no longer a place you just visit. It is an intelligent, ever-present layer of support integrated into your life, ensuring your safety and healing around the clock. With such advanced technology, a critical question remains. What is the role of the human healer? The answer is more vital than ever. Doctors and nurses have been liberated from administrative tasks and data analysis. They are no longer diagnosticians or pill counters. They've become medical conductors and empathetic strategists. The AI provides the symphony of data, the notes, the tempo, the instrumentation. But the human professional conducts the performance. They interpret the AI's predictions, apply wisdom, context, and nuance, and make the final, complex, ethical decisions. They are the arbiters of care, blending cold, hard data with warm human understanding. Their focus shifts entirely to the art of healing. They are the compassionate guides who explain a difficult diagnosis, the steady hand on a shoulder during moments of fear, and the strategic partners who help patients navigate their long-term health journey. Technology has not replaced them. It has redefined them. By handing over the repetitive and computational tasks to machines, healthcare professionals can fully embrace the roles that define their profession: healer, counselor, and trusted guardian. The future of medicine isn't about choosing between technology and humanity, but about fusing them to create a system that is both brilliantly smart and profoundly compassionate.